going to be a delegation question. So I know students often say like delegation and prioritization are tougher concepts to grasp. So I put a delegation question in here so that we can talk through this one. Okay, so we have a charge nurse who is supervising a registered nurse in the care of a client on a mechanical ventilator. Okay, and then we have the charge nurse should intervene if the RN asks the unlicensed assistive personnel, or UAP, to do which of the following tasks that we have described to us. Okay, so again, a lot going on up here, so we need to read this carefully. So we're looking for an action that would be inappropriate to delegate to a UAP. And depending on what state you're in, this might be like a CNA or a nurse's aide, right? An unlicensed assistive personnel. Okay, so 3 of these are going to be appropriate to delegate, and 1 of these is going to be inappropriate. So we're looking for the inappropriate one. So before we look, let's take a look at our 5 rights of delegation to help us remind ourselves kind of what we're looking for. So when we're looking for appropriate delegation, we need to look to make sure that we're delegating to the right person. So is, in this case, the UAP competent to do this task? Do they have the skill and the appropriate knowledge to do what we're asking them to do? Okay. Then we need to ask, is it the right task? And so is it in the scope of practice for the UAP to do what we're asking them to do? And is it a routine task with an expected outcome? Because remember, even though we're delegating that task, us as the RN are still going to be responsible for the outcome, right? So we need to be sure it's an expected outcome that we can evaluate. Is it the right circumstance? So is this client stable? So for this one, I always like to use the example of like client transfers, right? So we might often ask a CNA or a UAP to transfer a client from the bed to a chair, right? That would be totally within the scope of their practice. But what if this client that we're asking them to do it for has just come back from a total knee replacement and they've never done a transfer before? Well, in that case, we wouldn't know that that client is stable or not because we haven't assessed them yet. And so in that case, it would not be the right circumstance to delegate, even though it's within the UAP scope of practice to do a client transfer. Does that make sense? Okay, so we need to make sure that that client is stable. We've already assessed them and determined that it would be an okay task to delegate. And then do we have the right direction and communication? So basically, does this UAP understand what we're asking them to do? Do they have any questions? And do we have the right supervision and evaluation? So basically, can we evaluate this task that they've done, right? So we need to be able to follow up because, right, we're ultimately responsible for this task that we've delegated. So we need to be able to evaluate the outcomes of this task. So let's go back and see if we can figure out which of these tasks, remember, we're looking for which one is inappropriate. So would it be appropriate or inappropriate to delegate this to the UAP to turn the client from left to right side every 2 hours? Is that appropriate? Yeah. To move the client, reposition the client, turn them from right to left side so that they don't have skin breakdown would be within the scope of practice for a UAP. We can evaluate the outcome of that, right? Because we can see that their skin is maintaining integrity. So yes, I think that would be appropriate to delegate. So I'm going to say that would be appropriate. We don't need to intervene. How about number 2? Notify the RN when the client requires inline suctioning. Would that be appropriate to delegate? So I think to figure this out, we need to ask ourselves a couple of questions. So how would the UAP know when the client requires suctioning? They would have to assess that client, right? They would probably have to listen to some lung sounds, maybe look at O2 saturation. Okay, is it within the scope of a UAP to assess the client? No, right? It's not within their scope of practice to assess the client. That is the nurse, right? So can we ask them to let us know when they require inline suctioning? Well, no, because they would have to assess the client to be able to know when that needed to be done, and that's not within the scope of their practice. So I am going to flag this one here. I think that would be inappropriate to delegate, but let's take a look at our other options and see if we can make sure that that's the one we want to choose. So number 3 is perform passive range of motion exercises on the extremities. Is that okay? Is that within their scope of practice? Yeah, passive range of motion exercises, right? We can evaluate the outcome of that in terms of the client still having good range of motion. I would expect the UAP would have the skill and the knowledge to be able to do that. We're not asking them to assess anything, so I feel like that's appropriate, right? And then we have our last option, to measure the client's respiratory rate and pulse oximetry reading. Is that appropriate? So I think where students get hung up is between number 2 and number 4, right? And what's the difference between these two? What's the difference between 2 and 4? Well, in 4, we're asking the UAP to measure respiratory rate and pulse oximetry reading, they're collecting data. We're not asking them to assess that data. We're just asking them to collect the data, give those numbers to us. Is that within the scope of practice of a UAP? Yes, right? But in number 2, we're asking them to interpret this data, right? We're asking them to interpret what that means, which is not within the scope of their practice. So I like number 2, right? That would not be appropriate to delegate because we can't ask the UAP to assess the client, right? So let's see if we are correct. And yes, we are correct.